bone and joint injuries, skeleton and stuff around it, and injuries involving that. Generally, you're going to do this after you do a secondary survey. You're not going to be usually interacting with this stuff without doing that. You're also generally going to be doing a bone and joint injury when you're the one transporting the casualty. If paramedics are coming, all this immobilization stuff we're about to show you, they're just going to cut it off and do it themselves in a lot of jurisdictions, because very often they'll have a standard that says that whoever's transporting needs to be the person that immobilizes it. So they're just going to make sure that it's done right, even if it is done right. It's just what they're going to do. So once again, there's a specific situation where you're doing this, and very often you just deal with blood and then watch them and wait, and then paramedics do this for you. But what the hey, you might as well learn some of it anyways. Okay, bone and joint injuries have a few different things you need to know about before you work around this. A lot of this, some of this doesn't really affect what you do for the first aid. So for example, the difference between strain, sprain, fracture, and dislocation, you just treat everything like a fracture anyways, and you don't really care what the difference is. But there is one sort of nuanced difference with especially like a shoulder dislocation where you might change one bandage you're doing. And it's just good information to know so that when you're talking with your doctor, you kind of understand what's going on, and it might help inform the way you'd kind of learn about this stuff. So there's that. So we have to learn about those things. We have to also think about what a splint is and what a good versus bad one would be. So we'll talk about that. And then there's this thing called RICE that shows up in first aid courses. We're not talking about the food. We're talking about this acronym. I'm going to give you kind of like the important parts of it that just need to remember. But if you like acronyms, the acronym might be helpful. Other than that, if you don't like acronyms, then the information that it's supposed to teach you is the part you should focus on. Okay, strain, sprain, fracture, dislocation. A strain, S-T-R-A-I-N, is something that happens in the muscle or the tendon. So you have, for example, in the arm, you have bone, right? Then you have a muscle, and then you have tendons connecting the muscle between the bones that allow motion to happen, okay? That allow stuff, grippiness and all that, okay? Inside the joint, bone connecting to bone with no muscle, you have a ligament that connects them. We're talking specifically within the muscle system. So tendon, muscle, tendon, bone in there. That's where a strain occurs. If you've heard of repetitive strain injury, doing the same motion over and over and over again, the muscle and tendon system gets basically worn down. That's the type of thing, S-T-R-A-I-N, a strain. A sprain, S-P-R-A-I-N, is the other thing. It's the ligament. So it's the bone, ligament, bone, that thing inside the joint. If you've ever had chicken before, any sort of animal meat with bones on it, where the two bones are stuck together, like if you've had like a chicken wing or something where you have the two bones that are stuck, that thing in between the two bones, that's the ligament, that tough fibrous thing. When you have a ligament tear and you have a sprain, an ACL tear in the knee, for example, is another thing that people have commonly heard of. The recovery time can be very, very long. Sprains, generally speaking, among the bone and joint injuries, have the longest recovery time, although they're not usually the most life-threatening. The most life-threatening is usually your fracture that's open with blood loss, the blood loss being the problem. But sprains can be career-ending for athletes. One thing that a lot of athletes don't really appreciate, especially when they're younger, is, overtraining to the point where you cause a sprain. If you overtrain and you tear your ACL, you tear certain ligaments in your body, and medicine isn't advanced enough yet to help with this, your career of, getting Olympic gold, it's basically over. It's just not happening. These are career-ending injuries, potentially, if you have a really bad sprain. So you really, really, really should be paying careful attention to correct form, not overtraining, etc. A lot of the sports medicine stuff around this, the preventative stuff, is to help prevent these sorts of injuries. And, maybe if the coach says, you're done, you should stop. Maybe if, the team physician's like, you should not go back out on the field, maybe you shouldn't go back out on the field. Something to consider. Anyways, okay. Then we have a fracture, broken bone. You have open and closed. Open fracture meaning skin's broken, closed meaning skin is not broken. There's a bunch of specific types of fractures. You don't care. You care if the skin's broken or not to deal with bleeding. First aid, there's no real distinction. In medicine, there is. In first aid, you don't care. Skin's broken or it's not broken, that's it. Dislocation. Bone is out of socket, right? So a common one that people have referenced or heard is that old shoulder dislocation that like it comes out. Mel Gibson in Lethal Weapon. This is a popular thing that happened in the before time. His shoulder would come out and then he would find a wall and then just like ram it back in. Don't do that. The shoulders should be relocated. Bones should be relocated by a medical professional who knows what they're doing. If you just ram something back in, you can cause abrasion within the joint and tear more fiber on the way in than maybe even that happened when it dislocated, causing further dislocations down the road. Okay, so those are the big four. Next, we have splints. Now, splints need to be rigid. So this is a piece of cheap press board. So that's rigid, right? Ideally need to be well padded. So I'm going to take some, wrap triangular bandage here and pad this thing. And they need to extend above and below the injury. So assuming that I have an injury here of my wrist, I want it to extend to the connecting joint to that wrist that's down, which would be the elbow, and extend to the connecting joint after that, which in this case would be the first row of knuckles. So I want this to be long enough where if I tie that down, this ain't moving. That's the idea. The body is also a splint. If I had a broken arm, for example, and I was to splint it against the body, and I was to tie my arm against the body, skeleton is rigid, my, connecting to the skeleton is padded, the body is effectively a splint. You might have to add some padding in between to kind of make it a bit more immobile, but it can work as a splint as well. Okay, RICE. In bone and joint injuries, you want to put the person in a resting position. That's probably the position you find them in. You want to immobilize what's happened, where they are. You want to make sure that they are not moving the thing in whatever position you find them in. You want to apply, ideally, some sort of ice pack or cold thing, 15 minutes on, 15 minutes off. If you've ever had a tooth pulled before, it's the same type of idea for, icing the tooth or icing dental work. It's 15 on, 15 off. It's the same recommendation. Any sort of bone issue like that, 15 on, 15 off. If you apply cold to something for more than 15 minutes, more than 20 minutes especially, pain can increase, the body can go, temperatures change, rush blood to the area, increase bleeding. There's a whole bunch of things. 15 on, 15 off, okay? Just that's the recommendation I keep hearing. There may be a change in this on any given year to 16 minutes. It's the same general range of basically 15 minutes. And then after that, the last thing that's recommended is sometimes you want to elevate bone or joint injuries, but in first aid, you don't really do that. You tend to just immobilize in position found. You don't really elevate. So the elevate portion in first aid, I think I interpret more as once you've done the other three things, you can now move them with some sort of rescue carry. So RICE, the whole thing would be rest, immobilize, cold, elevate. And some places will say rest, ice, compression, elevation, where they flip the I and the C. And the compression would be, compressing something to immobilize it. It's the same thing. So in general, you want to put the person at rest. You want to restrict the movement. You want to use cold if you have access to it, some sort of ice pack if you have access to it, and then elevate as needed. With ice packs, don't just put an ice pack directly on skin. Wrap it in something, because if you put ice directly on skin, you can basically cause too much of a temperature difference too quickly to the skin. The skin can break. The skin can start adhering to the ice pack. Skin damage, problems. You don't need that. Wrap it in something and then apply it. That's fine. Okay. We've done all that. That's fantastic. Let's bandage some stuff.